The future of treating complex disorders such as chronic pain and fibromyalgia is not an I statement, it's a we statement. We all really have to be in it together. So me, I'm an internist, I'm an MD. I have to work together with other healthcare professionals to really help the patient come to grip with certain problems, but also solve problems they didn't know they actually solutions to. And we have to look at every avenue and every specialty as a potential solution for this. So this is what I like to call the collaborative care management model. So the collaborative care management model of healthcare is what we probably should have been doing in the first place. But in the current healthcare ecosystem, it's extraordinarily difficult to do that. It's hard enough for doctors to talk to other doctors, but it's even harder for doctors to talk to dentists, to orthodontists, to physical therapists. And gosh, who's got the time to do that? Well, we have to make time to do that. And in fact, we can. So in the collaborative care management model, we have to look at problem solving quite differently than compared to the traditional practice of medicine. And this is something I'm getting into at the Fibromyalgia, Chronic Pain, and TMJ conference. And this is specifically for healthcare professionals who wants to solve bigger problems. But not just wanting to solve bigger problems on an isolated island by themselves, but actually being within a group of people who want to solve the same issues. And this is where we have to marry all the different powers of all different healthcare professionals so we can solve these issues. But how? How are we going to do that? Well, you see, but now there's AI, there's ChatGPT, there's Google Bard, and all these different technologies that are available for the average consumer. You see, the average consumer, the average person will have so much data that's there. We as healthcare professionals really have to talk to each other to figure out what is the best strategy so that people don't get sucked into the woods, if you will, right? In this collaborative care management model, we also have to take AI into our own hands and use it very effectively for a communication process so that the patients themselves can have a pretty clear understanding of what to do. Recently, I started group trainings for my patients, teaching them how to use ChatGPT to solve some of their own issues, such as a grocery list, pricing lists, making Excels on ChatGPT. I also teach them how to talk to ChatGPT like they're a guide, like they're the guru, right? And then looking at what the output actually looks like. And we have to do that as healthcare professionals as well. You know, I could easily say, hey, you know what? I want you to eat healthy and here's some recipe books I can generate from ChatGPT. Or I could teach the patients to do it themselves. And in fact, they are coming up with some really interesting recipes and techniques in cooking that I find very, very amusing that I'm going to start using myself. So it becomes a community. And we can't see ourselves as healthcare professionals that are on our own little island, do our own little thing anymore, because artificial intelligence really has to level the game to a much higher level. The evolution through AI and what people have information and access to is extraordinarily powerful. And for us to not use that seems kind of silly, especially since that's the way that the world is going. You see, I see artificial intelligence as a way of stepping into where medicine should have been in the first place. And we take a lot of the ancient ideas about healing and what it really means and bring that into the modern world, especially with the assistance of artificial intelligence. Now we're seeing websites being made with artificial intelligence. Now we're seeing pictures being made, music, and a lot of different things can get very distracting very, very fast. But getting into the picture early, utilizing technology, understanding how to use technology to collaborate between each other is extraordinarily powerful. There's technology systems that utilize artificial intelligence for transcribing a conversation or rewording conversations, note-taking. There's artificial intelligence that suggest certain things to do when it comes to either medical decision-making or documentation, or summarizing this so that the patients and their families can understand in a language that's not over their heads. And that's really important as well. We also are going to be in this world where we have to make our time effective. So by the time I'm talking to a patient, I should have AI generate a note, generate a referral note to someone else, okay? And that someone else will read it and quickly understand exactly what I saw the patient for. It makes this collaborative care management so much more powerful. It's going to save lives, decrease costs of healthcare, and significantly improve the way that we can actually communicate with each other, especially as healthcare professionals. The collaborative care model is already in existence, and there's some beta versions that are being used, especially with the advent of ChatGPT. And it's out there. It's coming, whether we like it or not. But to me, it's always a really, really good and important thing. Another element of the collaborative care model is to understand how it applies with medical insurance. How can you collaborate with another healthcare professional? How can it make sense in medical insurance billing? What CPT codes to use during those times you're collaborating with healthcare professionals, so that if you're sending a message or chatting with another healthcare professional on your patient, well, there's ways that the insurance companies will reward you for that, to literally help take care of the patients that's in their membership. And that's what it's for. And in fact, a lot of doctors are already doing it and not necessarily billing for it, and being really burnt out because there's no structure for it, because there was a preconceived notion that insurance doesn't necessarily pay for collaborative care management, but there are models that currently exist, and we have to know what they are. And that's something I'm going to teach you at the Fibromyalgia, Chronic Pain, and TMJ conference here in Houston, Texas. Along with the collaborative care model, there's also revenue models that are there. Let's face it, we're in the business of medicine. If the revenue is not there, we can't practice medicine. In fact, if you look at the last few generations, physician and other healthcare professional salaries hasn't necessarily increased, while inflation has gone like this. In fact, a lot of primary care physician salaries have decreased over the last few years as well. And so the cost of healthcare is going up, the reimbursement structures are going down. So we have to understand what is it that can make this work. And not only that, how can we deliver the absolute best healthcare for our patients by understanding this collaborative care model? And who are the players in the collaborative care model? Are health coaches involved? Are medical assistants, administrators? Who are these people? We really have to reconsider the entire structure of medicine through the lens of absolute collaborative care. And that's what we're here to do. Hope to see you at the Supporting Fibromyalgia and Chronic Pain and TMJ conference here in Houston, Texas.